Have you ever found yourself holding a book farther away just to read the words? Maybe driving at night feels more difficult than it used to. Perhaps bright lights seem harsher, colors don't look quite as vivid, or you need much more light to read comfortably. Most people assume these changes are simply a normal part of getting older, and sometimes they are. But here's what many people don't realize. Certain vision changes after 60 can be more than just signs of aging. They can be early warning signals that something bigger may be happening inside the body. In some cases, your eyes may reveal health problems long before symptoms appear elsewhere. That's one reason eye doctors often describe the eyes as a window into overall health. Today, we're going to explore the vision changes after 60 that should never be ignored, what they may signal, and why paying attention to your eyesight could help protect much more than your vision. Let's get started. 1. Needing more light to read. Let's begin with one of the most common changes. Many adults notice that reading becomes harder in dim lighting. Suddenly, the lighting that worked perfectly 10 years ago doesn't seem bright enough anymore. This often happens because the eye's lens gradually becomes less flexible and allows less light to reach the retina. In many cases, this is a normal part of aging. However, if the change becomes unusually severe or progresses rapidly, it may warrant further evaluation. The important lesson is simple. Don't automatically assume every vision change is harmless. Gradual age-related changes are common. Sudden or significant changes deserve attention. 2. Difficulty driving at night. Night driving becomes more challenging for many people after 60. Headlights may appear brighter. Glare may become more bothersome. Road signs can seem harder to read. Reaction time may feel slower. One common reason is the development of cataracts. Cataracts occur when the normally clear lens inside the eye becomes cloudy. They develop gradually and are extremely common with aging. The problem is that many people adapt so slowly to declining vision that they don't realize how much their eyesight has changed. If night driving has become noticeably more stressful, it's worth discussing with an eye care professional. 3. Blurry vision that comes and goes. Occasional blurry vision may not seem alarming, but recurring episodes should never be ignored. Fluctuating vision can sometimes be associated with blood sugar problems. When blood sugar levels rise and fall significantly, the shape of the eye's lens can temporarily change. The result may be blurry vision that seems to come and go. In some cases, vision changes may actually be one of the earliest signs of diabetes. This is one reason routine eye exams are so valuable. Sometimes the eyes detect metabolic problems before other symptoms become obvious.
4. Seeing dark spots or floaters. Have you ever noticed small specks, cobweb-like shapes, or floating shadows drifting across your vision? These are called floaters. A small number of floaters is often normal, especially with age, but a sudden increase in floaters is different. If floaters appear suddenly, especially when accompanied by flashes of light or loss of peripheral vision, it could indicate a retinal problem that requires immediate medical attention. Retinal conditions can sometimes threaten vision if not treated promptly. That's why sudden visual changes should never be ignored. When it comes to eyesight, timing matters. 5. Losing peripheral vision. Peripheral vision refers to what you can see outside your direct line of sight. Many people don't notice gradual loss of peripheral vision because the brain compensates remarkably well. One condition that can affect peripheral vision is glaucoma. Glaucoma is often called the silent thief of sight because it may cause damage slowly and painlessly. By the time noticeable symptoms develop, significant vision loss may have already occurred. The encouraging news is that regular eye exams can often detect glaucoma before major vision problems appear. This is one reason preventative eye care becomes increasingly important after 60. 6. Distorted or wavy vision. Imagine looking at a straight line and noticing that it appears bent or wavy, or perhaps words on a page seem distorted. These symptoms can sometimes be associated with age-related macular degeneration. The macula is the part of the retina responsible for sharp central vision. When it becomes damaged, reading, recognizing faces, and performing detailed tasks can become more difficult. Macular degeneration is one of the leading causes of vision loss among older adults. Early detection can make a significant difference. That's why unusual visual distortions should never be dismissed as just aging. 7. Changes in color perception. Many people are surprised to learn that aging can affect how colors appear. Colors may seem less vibrant. Certain shades may become harder to distinguish. Again, cataracts are often involved. As the lens becomes cloudier, it can affect how colors are perceived.
While this change is often gradual, significant alterations in color vision deserve professional evaluation. The eyes are providing information. It's important to listen. 8. Double vision can signal serious problems. Occasional eye strain is common. Double vision is different. Seeing two images instead of one can sometimes indicate issues involving the eyes, nerves, muscles, or even the brain. In some cases, double vision may be associated with neurological conditions or vascular problems. Because the causes can vary widely, double vision should always be evaluated promptly. This is especially true if it appears suddenly. When it comes to neurological health, the eyes often provide important clues.
9. Your eyes can reveal cardiovascular problems. Here's something many people don't know. Eye doctors can sometimes see signs of cardiovascular disease during routine examinations. The blood vessels inside the eye provide a unique opportunity to observe circulation directly. Changes in these vessels may sometimes reflect high blood pressure, diabetes, or other vascular conditions. In some cases, an eye exam becomes the first step toward identifying a broader health issue. This is one reason comprehensive eye care is about far more than vision correction. It's also about overall health monitoring. 10. Why so many people ignore early warning signs? One of the biggest challenges with vision changes is adaptation. The brain is incredibly good at compensating. Changes often occur gradually. The decline happens so slowly that many people simply adjust without realizing it. They stop driving at night, they use brighter lights, they hold reading material farther away, they unconsciously adapt. Unfortunately, adaptation can delay diagnosis. That's why regular eye exams remain one of the most valuable preventive health habits after 60. You may not notice a problem, but an eye professional often can. The bigger lesson about aging. One of the most important lessons about healthy aging is that small changes matter. Many serious conditions don't begin with dramatic symptoms. They begin quietly, gradually, almost invisibly. Vision changes are a perfect example. Sometimes they're harmless consequences of aging. Sometimes they're early signals that deserve attention. Knowing the difference can make all the difference. Not every vision change after 60 is a cause for concern. Many are simply part of the natural aging process, but some changes can quietly signal bigger problems. Difficulty driving at night, sudden floaters, blurred vision, loss of peripheral vision, visual distortions, double vision, and other unusual changes should never be ignored. Your eyes don't just help you see the world. They can also provide valuable insight into what's happening throughout your body. That's why regular eye exams remain one of the smartest investments you can make in your long-term health. Because protecting your vision isn't only about preserving sight. It's about protecting your independence, your safety, and sometimes even your life. If you found this video helpful, let us know in the comments. When was the last time you had a comprehensive eye exam? And don't forget to like, subscribe, and turn on notifications for more science-backed healthy aging tips designed to help you stay strong, healthy, and independent after 60. Thanks for watching, and we'll see you in the next video.